Good morning and welcome to the launch of Health Taxes Policy and Practice. My name is Jack Olney. I'm the manager of the Centre for Health Economics and Policy Innovation based at Imperial College Business School, which is hosting this event in collaboration with our colleagues at the Department of Health Systems, Governance and Finance at the World Health Organization. So pleased to welcome you here, both in person and online, where we've had up to 500 people registered, so that's fantastic. I'd now like to hand you over to our moderator for the day. This is Dr. Anjana Ahuja, a contributing writer to the Financial Times, a former columnist of the Times, and she also holds a PhD in physics from Imperial College. So, Anjana, over to you.
Thank you very much, Jack. So as Jack said, I'm Anj Ahuja, call me Anj, and it's a real pleasure to be back in my old college as your host today. And I'd like to extend a warm welcome not just to the people in the room, but also the many who are joining us online for the very important launch, the global launch of Health Taxes, which is a groundbreaking book produced jointly by the Centre for Health Economics and Policy Innovation at Imperial College and the World Health Organization. So I had an advance copy, which I was reading on a trip to Brussels this week. And as someone who writes about evidence and policy, particularly in the field of science and global health, I have to say I found it incredibly engaging, provocative, and I have to say that's not something that I've ever thought I would say about a book on fiscal measures. So from a domestic point of view, the launch of this book has come at a fascinating time in the UK, given the release of the National Food Strategy in 2021, and also the recent publication of the UK government's food strategy policy paper. So today, if you forgive the pun, we will be feasting on this content, and we'll be hearing from the editors themselves, and from the World Health Organization, plus there'll be a keynote speech from Henry Dimbleby, a leading and influential campaigner on food strategy in the UK. We have lightning talks on a handful of chapters, which will give you a flavour of what the book is about. But first, I'm delighted to introduce Professor Ian Walmsley, who is the Provost at Imperial College, to formally open today's event.
Well, welcome to the launch of this major analysis of taxes designed to influence behaviours that improve human health. As one of two areas in life that are certain, I think we can add a third, which is uncertainty. And so I'm really delighted to see that we're getting used to rapid adaptability in the blended world as events unfold around us. So welcome both to the in-person audience here and to the many of you online through the World Health Organization Health Systems Governance and Financing webinar series. So a good morning. The publication of this book is an indication of the importance that Imperial College London places both on research and on impact. We seek both to understand the world and to make it a better place based on that understanding. But ensuring that our work has an impact means building partnerships that can deliver that impact. These partnerships span all sorts of organizations across the academy, across industry, across government, across non-government organizations. And it is through those partnerships that we can begin to design and implement evidence-based solutions to some of the major societal challenges, as well as to support policy development that really guides how we're going to overcome some of these barriers to change. Our policy engagement program, for example, the Forum, helps link academics and policymakers to share our latest research and expertise. And the Centre for Health Economics and Policy Innovation, led by Professor Franco Sassi and Dr. Jack Olney, is really our flagship research centre on health at Imperial College Business School, and a prime example of how those partnerships are facilitated and really help to deliver the sort of change that we need. A good example of that is the way in which they helped inform the UK's National Food Strategy and also responded to it when the government released their policy paper. The collaboration now between the Center for Health Economics and Policy Innovation and the World Health Organization really underlines the positive impact that research in universities can have in offering evidence-based solutions to real-world policy challenges. And those partnerships, as I say, are really key from the outset, both co-creating the research and helping to deliver impact from it. It's the prime example and one we're focused on today, but it's certainly not the only one across the college. We're working with policymakers in other areas around data protection, for example, and leading policy debates on changes we need to make around the energy transition, electric vehicles, for instance, as well as thinking about next generation information processing and the impact of some areas of fundamental physics like quantum mechanics on the opportunities in that space. So with this as a good example today of the connection between research and impact, we'll continue to do outstanding research at the college as this book exemplifies, and we'll continue to find partnerships that help us co-create the ideas and solutions based on our research to make the world a better place. So the launch today is a really good example of how that partnership will work, and best wishes for a very successful and interesting event. The lineup looks really fantastic, and I look forward very much to our keynote speak in this area. Thank you.
Thank you very much, Ian. It's now my pleasure to introduce Dr. Rüdiger Kresch. He's Director of the Department of Health Promotion at WHO, and he's taken time out to send us a message.
Good morning, esteemed colleagues. I'm delighted to welcome you, along with the editors, to the launch of the book Health Taxes, Policy and Practice. Each year, 41 million people die from preventable non-communicable diseases, such as cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. Most of these deaths occur in low and middle income countries. These deaths could be avoided by eliminating tobacco use and alcohol misuse, and by improving unhealthy diets. One of the most cost-effective ways of achieving this is through the intelligent use of health taxes. The aims of health taxes is to reduce the consumption of unhealthy products. Another is to disincentivize unhealthy behaviors that are typically associated with such products. Health taxes achieve both these aims by changing the price faced by consumers so that healthier choices are promoted. Health taxes can also serve as a revenue booster for governments, a fact which is particularly relevant now as governments are facing the challenges of financing the Sustainable Development Goals. Now, more than ever, health taxes can play a vital role in achieving the twin goals of improving health outcomes and in strengthening the public sector. Despite their demonstrated benefits, health taxes remain underutilized globally. WHO spearheaded a multi-year program of knowledge exchange with leading experts in the field of health, tax policy, public financial management, trade law, and public governance. The discussions are now chronicled in this book, Health Taxes, Policy and Practice. The book reflects the first global in-depth discussion of health taxes as an independent domain. It addresses the expressed concerns of policymakers and of fiscal sector practitioners in particular, and provides a long-needed bridge between global health and fiscal policy concerns. With that, I wish you all a very productive launch and hope that this book will contribute to tangible advances in health, revenue, and development globally. I thank you.
Thank you very much, Rüdiger. So we're now going to hear from the editors who have worked so hard to bring this project together. Each is going to just say a few words of welcome, set the scene, and they're going to set the stage for the discussion to come. I'm going to introduce them in the order in which they will speak. So first, we have Professor Franco Sassi. Franco is currently Chair in International Health Policy and Economics at Imperial and Director of the Centre for Health Economics and Policy Innovation at Imperial College Business School. He's also a former senior health economist at the OECD. And he's done a lot of highly regarded work around childhood obesity, among many other things. After Franco, we're going to hear from Dr. Agnes Souka. Agnes is the Director of the Division of Health and Social Protection of the French Development Agency. She was previously the Director of the Department of Health Systems, Governance and Financing at the WHO and is an innovator in health financing, such as community-based financing. After Agnes, we're going to hear from Professor Jeremy Lauer. Jeremy joined Strathclyde University in February 2020 as Professor of Management Science, following a career as an economist with the WHO. In 2016, while at WHO, Jeremy initiated and subsequently led a global WHO project on health taxes, health financing, and fiscal reform for health. And last but not least, after Jeremy, we'll hear from Anjali Vigo. Anjali, who's with Franco at the front here, is a trained lawyer with a distinguished background in tobacco regulation, who now co-manages the interagency collaboration on health taxes at the World Health Organization. And there are around a dozen international organizations involved in that collaboration, including the World Bank, the OECD, and the Asian Development Bank. So, Franco, if I could invite you to kick off, please.
Thank you, Angel. Thank you, Ian, for your very nice remarks. Welcome, everyone in the audience. Let me just say that one word that you're going to hear very often today is timely, because this book is very timely. It has taken years to produce, but it's coming out at a time when it's going to hopefully make a big impact. Innovation happens at times of crisis. There's no shortage of crisis at the moment. If we look back at the last few years, the greatest momentum for health taxes was about 10 to 12 years ago, in the aftermath of the big economic and financial crisis that hit the world at the time. It was the time when many governments introduced new taxes, new health taxes, particularly on sugar-sweetened beverages and other foods, and increased many other health taxes throughout the world. Now, this is going to happen again. We see interest rising again in health taxes, but we are in a much better place today because we have a lot more evidence. We know a lot more about how these taxes work and how they should be used. And that is exactly what this book is about. Of course, we are all very concerned about inflation, about the rising cost of living, but that should not be a barrier to thinking about health taxes. In fact, 1/3 of the revenues that governments are collecting, the tax revenues that governments are collecting from people today is from consumption taxes. And in many instances, those consumption taxes incentivize the wrong type of consumption that leads to harm to health and to the planet. So with health taxes, we have an opportunity to align the objectives of taxation to the things that matter to people, matter to society. And that is exactly what we hope this book will be doing. Let me just say, if we have the slide with the contents of the book, let me just say what the book is going to cover, because we're only going to see a snapshot of it today. This is one of the several launches that will take place around the world in the next few months. So the book is covering overall areas like where health taxes fit in fiscal systems, what the effects are of health taxes on consumption, health, on industry, on the economy more widely, and how governments should be designing effective and efficient health taxes. We're also going to deal with, thorny political economy issues and how governments should be dealing with stakeholder reactions to health taxes. And then we think about what the future of health taxes should be. You can find all of this in the book, and we look forward to discussing this with you today.
Brilliant. Thank you, Franco, for setting the scene. Can I now invite Dr. Agnes Souka to present her thoughts and set the stage for the coming discussion?
Thank you very much, and thanks to Imperial College and WHO to organize this book launch. And I will follow on Franco's point, an incredibly timely book. And I think the first point I want to make on how important this book is that taxes and fiscal instruments in general are one of the most important, if not the most important, expression of collective action. It is about bringing resources in one pool. It is about contributing to the larger purpose. And it is about funding public goods. This is the core of the collective project, of the social contract. And in today's world, and in a pandemic, COVID-19 pandemic world, the role of the commons has been highlighted, and the lack of investments and the lack of strategic thinking and understanding of the importance of the commons, and among those, the fiscal instruments, has been really highlighted. So as we are all reflecting on the lessons learned of the COVID-19 pandemic, we really need to think about common goods for health, and among those, fiscal instruments and taxes and subsidies. And those are really, they should be, and that would be my second point, they should be at the heart of the public health framework in the post-COVID world. Health taxes should be part of pandemic preparedness investments. They should be considered in the policy dialogue of pandemic preparedness when we know the interaction between NCDs and the health outcomes related to the COVID-19 pandemic. We need to look at how health taxes can play a role in tackling the health challenges of today, beyond the products that are taxed today, whether it is tobacco, alcohol, and sugar, and think about how can we think about those instruments when it comes to tackling much broader challenges at a time where we have to face the threats of climate change, biodiversity loss, AMR, and so on. And I will really finish by saying that these instruments should really be part of broader fiscal policies. They need to be part of the public health framework. But we know now that markets are increasingly global, and that the avenues we've been pursuing so far are mostly country dialogue. But these country dialogues need to be increasingly harmonized. And I really see this book as extremely important in triggering a global conversation on the harmonization of fiscal framework, harmonization of the policy approaches to health taxation, and having a global agenda that is actually thinking a little bit more on how we can learn from the effectiveness of these taxes that are well documented in this book, and bring it into the global conversation on having global agreements and global harmonization of policies. Thank you again for having us today.
Thank you very much, Agnes. So now we're going to move on to Professor Jeremy Lauer.
Thank you. I'm very pleased to be able to speak immediately following Agnes. It reminds me of in 2016 when Agnes Suka asked me to get involved in a stream of work around health taxes in the health systems cluster of WHO, where we then both worked. I was, at the time anyway, rather strongly opposed to the idea that I should do that. And as most people then, I knew health taxes only as isolated measures targeted mainly at alcohol and tobacco, or as a series of mostly failed initiatives to tax various components of food, such as salt and fat. Sugar-sweetened beverage taxes were, at that time, one can still say, still only starting to emerge into the broader consciousness of global health practitioners. Now, one can be wrong about many things, big or small. But I like to think of Agnes and the years in which we've worked together really as one person who, in my experience, is routinely right about the biggest and most important things. And in 2016, Agnes was 100% right, although I didn't see it, about the critical role that health taxes would come to play in universal health coverage and in the sustainable development goals more generally. My own view these days is that health taxes are, even more just the thin end of a wedge of a needed thoroughgoing redesign of fiscal policy that will be centered around human flourishing, rather than one centered merely on the income-mediated aspects of human welfare. Indeed, it's hard in the current environment in which the governments of the world have in the last 2 and so years spent the equivalent of $20 trillion on the COVID response. It's hard to imagine that universal health coverage will ever be possible without such a redesign of fiscal policy. Health taxes are a fitting spearhead in this development, as they are a means of strengthening people's health and at the same time people's communities, by which I mean global public goods, also called common goods for health, to which Agnes referred. Health taxes are also one of the few actions in health that is a one-stop shop, i.e. that represents in one action what normally requires policy plus financing plus procurement plus supply chain plus delivery platform plus a technically effective intervention. Finally, and as a result of that previous point, in fact, health taxes are, in my growing view, really a bridge to a future of global health that does not and cannot depend primarily on the health system as currently conceived, namely as limited to biomedical interventions delivered by health workers in health facilities, as important as these are. Health taxes are ultimately about empowering individuals to make more effectively the decisions they say they want to make for themselves. No one would rationally turn down a magic pill that offered them years of additional healthy life. And this is precisely what health taxes and other measures like them that empower individuals with the information that they need when they need it are. The magic bullets of the last century may have been antibiotics. The ones of the coming century are fiscal measures and other forms of human empowerment. Thank you.
Thank you very much, Jeremy. And now I'd like to pass over to Anjali Vigo.
Thank you very much. It's a pleasure to be with you all. My colleague Rudiger highlighted the magnitude of the NCD problem. It's not just a problem that rich countries have to grapple with. It's really a huge global issue. And health taxes represent, or was one of the most effective ways to address the NCD problem. So this book is the first publication which deals with health taxes in a very comprehensive manner. It explains the various aspects of taxes on tobacco, alcohol, and sugar-sweetened beverages, and it touches on other health-related fiscal measures. This book is a good complement to the official recommendations and guidelines on health taxes, such as the Framework Convention on Tobacco Control, which is the Treaty on Tobacco Control, as well as the resolutions and decisions of the World Health Assembly. It took a village to assemble this book, and as you will discover, we have assembled a pretty impressive village of experts. We have tax experts from the OECD and the World Bank. We have contributions from noted experts from academic institutions such as Imperial and Cambridge. And we also have contributions from members of civil society organizations who have pushed for and advocated health taxes in their home countries. We hope that this will be a useful resource for policymakers and researchers worldwide supplying them with the evidence and well thought out policy ideas they need to propose effective solutions. For example, the OECD experts show that health taxes contribute a whopping 0.8% of GDP in the countries which have adopted them. Preeminent health tax economists Lisa Powell and Frank Chaluka discuss in chapter 3 of the book how countries like France reduced both cigarette usage and lung cancer deaths by raising tobacco taxes. And Martin White and his team at Cambridge demonstrate that business can rapidly adapt to health taxes without losing out financially. So you're probably aware that here in the UK, sugary drinks became less sugary right after the announcement of the levy and even before its actual implementation, without hurting the bottom line of the affected industries. I will mention the buzzword again. This book is timely. My colleagues have already mentioned the revenue issue. They've also touched upon how health systems are overburdened and underfunded. And I think people have also become more aware how non-communicable diseases increase their risk for developing more severe symptoms of other diseases like COVID-19. So well-designed health taxes can help address all of these concerns and so much more. Thank you very much, and I look forward to the discussions.
Thank you so much, Anjali. So we've had a real setting of the scene there, haven't we? From the magic pill to, the whole overhaul of the fiscal system globally. So not at all ambitious, I think. So now we're going to move on to our keynote speaker, Henry Dimbleby. He has become synonymous with progressive food policy in the UK. He co-founded the Lyon restaurant chain and also co-founded the Sustainable Restaurant Association. He also co-authored the 2013 School Food Plan in the UK, which aimed to transform what children eat in schools and how they learn about food. And that led to universal free school meals for younger children in British schools. Henry was appointed lead non-executive board member of DEFRA, the Department for Environment, Food and Rural Affairs, in March 2018, and most recently led on the National Food Strategy, the first independent review of England's food system for 75 years. It aims to deliver healthy, affordable food to all that respects the environment, is sustainable, resilient to shocks, and contributes to both urban and rural economies. I'm going to invite the editors to come and take a seat in the front row, and we're going to pass the floor over to you, Henry.
Thank you so much. I've spoken a lot since we published the food strategy in July last year, but this is the first time I've been back into an academic context since I graduated in physics and philosophy many years ago. And actually, I looked into one of my quantum mechanics books last night, still sits on my bookshelf, and couldn't understand a word. Literally couldn't even remember doing the exams. So I'm more nervous today than I have been, I think, speaking anywhere over the last 3 or 4 years when I've been doing this. I guess why I'm here is that one of our recommendations was a health tax. It was a sugar and salt reformulation tax. And the intention of that tax was to, as the name says, reformulate products rather than increase the price of them. And on the day that we published our report last July, the Prime Minister was collared on a trip that he was making, and he said he wasn't in favour of additional taxes on hardworking people, which was assumed to be a rejection of the whole plan. But actually, who is in favour of extra taxes on hardworking people? And therefore, I thought what would be useful today is, first of all, to set in context the work that we did on the food strategy, and then to talk about the particular of the tax that we put in, the sugar and salt reformulation tax, how we thought about formulating it, and the political landscape in terms of getting these kind of things in place. Because I think that political landscape exists much more broadly in terms not only of just health taxes, but also taxes on any externalities in any form. And it's important to get not only the policy right, but also the framing right. And I think that would be useful in this context. And I think that this book will play a fantastic role actually in both of those things. So what was the National Food Strategy? The National Food Strategy was, my job was to say, how could we create a food strategy that not only fed us healthy food affordably at a reasonable price, but also stop killing us and stop destroying the environment. And I think it's useful to remember where we came from in our food system, because when you talk to people, farmers, people in the food industry, they feel at the moment very demonized. They feel responsible for all of the world's ills. And actually, we have to remember that our food system, as well as being a disaster, was a miracle. And in fact, that miracle, can I have the slide back, please? Thank you. And indeed, that miracle created, in many ways, the disaster. So if you look back at the food system, after the Second World War, despite all the bloodshed, we had a serious problem. The population of the world had risen from 1 billion to 1.5 billion over the last 90 years. And if you look at the front pages of the newspapers immediately after the Second World War, there was a genuine fear that we wouldn't have enough food to feed the planet. So this chart here shows three things. It shows the total agricultural land in production at the bottom line. It shows the population of the UK, the middle line, and global food production, the top line. And basically, since the Holocene, since the period of stable climate that started about 10,000 BC and enabled farming, the human response to population increase had been to dig up more land and farm more land. And at 1945, scientists were looking at the fact that population was going to rise hugely and there wasn't really much land to dig up. And what those scientists had failed to factor into their equations was a man called Norman Borlaug, who was a botanist from Idaho. He'd grown up in the Great Depression. He had seen real poverty on his doorstep. He'd seen food riots, and he set him out on a mission in life to transform the way in which we farm food to enable everyone to eat a decent diet. And during the Second World War, he went to Mexico. He saw the poverty of the soil there, the poverty of the population. He wrote a letter back to his wife saying, the people, the places here have clubbed my mind. I don't know what to do, but we have to do something. And what he did was scuttle from the coastal areas of Mexico to the plains, breeding different kinds of wheat, managed to get 2 crops a year, which accelerated his ability to make progress. And he developed what is now the predominant form of wheat worldwide, which is short-stemmed with much heavier grains, but short-stemmed so that the wind doesn't knock it over, and is resistant to wheat rust. And with the combination of that and chemical fertilizer created using the Haber-Bosch process and modern methods of irrigation, Mexico went from having to import wheat in 1945 to being self-sufficient in 1960. And the same policies were used, the same methods were used for maize and for rice and across the world. And we now produce 1.7 times the amount of food per person on the world than we did back then. We massively increased the population. Actually, we've taken a bit of land out of agriculture and we have produced much more food. This is one of the great miracles. A third to half the people on the planet today, 1 in 3 to 1 in 2 of the people you know would not be alive today if it hadn't been for this revolution. But this form of agriculture completely dominates our ecosystem now in a way that it was hard to imagine then, and actually the scale of it is still almost impossible to imagine. So this side shows the total biomass of animals on the planet, invertebrates and birds, land animals, in 10,000 at the beginning of this period of stable climate, versus the 2.5 million people who lived on the planet at that time. And as you can see, the wild animals completely dwarf the people on the planet today. If you look at the situation today, it's somewhat different. So the people have grown from 2.5 million to 7.8 billion. The wild animals are actually much smaller in weight, in total weight, partly due to our initial enthusiastic hunting of megafauna and then the expansion of agriculture. In fact, the animals that we keep as pets, horses, cats and dogs, now weigh almost as much as all wild animals together. And the animals on the left-hand side that we grow to feed us now weigh twice as much at any one time as all the people on the planet, and 10 times as much as all of the wild animals. And what this
that the impact on the environment of this growth in agriculture is hard to exaggerate. So if you look at the main problems, environmental problems that we face in the world today, if you're worried about biodiversity, food is almost uniquely responsible for the collapse of biodiversity. If you're worried about fresh water shortage, fresh water pollution, you have to look at food. If you're worried about deforestation, look at food. If you're worried about the clearing out of our oceans, look at food. If you're worried about climate change, food alongside energy, food system creates about 20 to 30% of all greenhouse gas emissions. It is food. And so if we are going to restore our environment, we need to look at the food system. But it isn't just the environment that this new form of farming and food production has hurt. It has also hurt our weight. This chart shows the number of people who are obese in the UK today. Well, actually, it shows the spread of weight. So on the y-axis, you have the proportion of the population. On the x-axis, you have the BMI of the population. If you had looked at this in 1920, you would have seen a very neat bell curve on the left-hand side. And that bell curve has been moving to the right steadily, accelerating in the 80s until you see a situation where this line here is obesity, this is severely obese, over half the population are overweight or obese, but also you see a tail. So there's something in this food system that to some of us is particularly more toxic than to others. So that's the context, that's the system. We then said, well, what do we do about this? How do we even understand this? And people said to us, you need to think about this in a systems way. And we then said, well, what do you mean by a systems way? And one of the things that we were often shown was this chart, which is a kind of, it's known as the Foresight obesity chart and it shows all of the different factors that make people obese, social factors, marketing factors, family factors, and it looks like a kind of demented spider's web. And it's very clever and it's very interesting, but it's not very helpful because you look at this and actually when you're trying to talk to policymakers or even trying to work out what your intervention should be, it is so difficult that it makes you want to give up. Another chart that we were shown is this, which was created by Kelly Parsons, who's in the audience today. And this shows the fact that policy for food is spread all the way across government. So every department has a role in creating food policy. And the idea here is therefore it's very difficult to get a unified strategy because everyone wants their piece of the action. And this is true. And it makes implementation difficult. So if we look at the UK context, on trade, there are massive fights between DEFRA, the Department for Environment, and the Department for Trade about what our trade policy should be in terms of importing goods that are produced to low animal welfare standards, low environmental standards. In terms of the taxes that we're talking today, you've got to broker an agreement between DEFRA, who is largely supportive of industry, between BEIS, the Department for Business, Treasury and Health. It's a difficult place to form policy. But that isn't the cause of the problem. So you have to say there's something else causing the problems. This is something that makes the solving of those problems difficult. And when we looked at what was causing the problems, we thought about systems theory as defined by the science of systems dynamics, which actually started, interestingly, in biology, but then was spread by MIT and Jay Forrester's work at MIT, again in the mid-40s. And here you try to look at what are the feedback loops in these complex systems that are going wrong? What is it that is causing the system to behave in the way it is? And there are two feedback loops in this particular system that are going very wrong. On the environmental side, and I won't talk much about this, you have what we call the invisibility of nature, and this was pointed out by Partha Dasgupta, the economist, in his absolutely brilliant review of the economics of biodiversity for the Treasury. And he points out that not only in all of the systems that we use to measure human achievement, human progress, nature doesn't feature, it's not in our wallets, it's not in the balance sheets of companies, it's not in the way we measure GDP, but actually governments subsidize the destruction of nature to the tune of about $500 billion a year in subsidies to fossil fuel companies and to big agriculture largely. So we're not even measuring nature, we're giving it a negative cost. We are paying companies to destroy nature. And he estimates that destruction costs us all about $7 trillion a year, or $5 to $7 trillion a year. In the health side, we identified what's called a reinforcing feedback loop. So this is what the Sun's view, Sun, for those of you who are not in the UK, is a populist right-wing newspaper here, and their view when advertising restrictions last year on the advertising of junk food were to be put in place was that they were ridiculous, and then when they were delayed, they said that's fantastic, and they said, how about applying the same common sense to other failed measures, like the sugar tax, which won't trim an ounce off anyone's weight, then concentrate on the real solutions, better education on diet and exercise. And this idea that better education and exercise, and therefore willpower, will solve our problems is completely prevalent in the UK, particularly actually amongst those people who suffer in these circumstances. And it is measurably, provably false. So exercise and the doubly labeled water studies have shown this time and again is it's fantastic for your health. It is, if you talk about the magic pill, if you could take exercise as a magic pill, it would be the single thing that you could do to improve your health. But it is pretty lousy at making you lose weight. And because your body reacts and your metabolism reacts and you move energy from your reproductive system and your immune system to replace that energy that you're exercising with. So it's not very good at making you lose weight. And actually telling people that it is means that they go to the gym, they try to lose weight, and they give up because they fail, and they stop doing probably the single thing they could do above anything else, whether they are fat, thin, to make them healthy. And we also know that willpower is not part of the situation either. Actually, thanks in a good deal to Kevin Hall's work, another physicist in the States. So what is going wrong? What's going on here in terms of the health system? Well, we describe the problem as the junk food cycle. So if you look at what's going on, it's pretty simple, actually. We have an appetite that evolved in a world that was very calorie scarce, that makes us seek out foods that are calorie dense, makes them absolutely delicious, particularly foods high in salt and sugar and fat. And also when we eat them, if they are low in fiber, the hormones that suppress our appetite are released more slowly with other foods than with other foods. So unsurprisingly, food companies have spotted that these kinds of foods are easier to market, they're easier to promote. They over time have spent more and more money promoting them. We've eaten more, they spent more money promoting them, we've eaten more, and we have got sick. And we're not going to break that interaction until we break that relationship, that commercial relationship, which makes it more attractive to do those things. And if you want to get a size, the scale of this problem, this chart here shows on the left-hand side the total amount of money consumers, citizens spend on fruit and vegetables a year, which is £2.2 billion in the UK, against the total amount of money they spend on confectionery, one tiny category in junk food, which is £3.9 billion a year. And what is interesting is that behind the scenes, the CEOs of the companies, fast-moving consumer good companies, supermarkets, admit that this is a problem. They are as stuck in the junk food cycle as the consumers are, because if they stop doing this, their competitors will continue and they will get fired. It's as simple as that. And they will say this to you. They will say, we need state intervention. So what does a good system look like? A good system, we said, has a number of features. If we were eating the right kind of food, we'd be eating fruit and vegetables, 30% more, 50% more fiber, reducing the amount of foods high in sugar, salt, and saturated fats by 25%, and reducing meat production by 30%. That, by the way, is not largely a health issue. nor is it actually largely a methane issue, the methane emissions of ruminants. It's largely a land issue. So 85% of the land in the UK that we use is used either to rear animals or to grow food to feed to animals. And we need that land now to do other things, to sequester carbon and restore biodiversity. So if those are the targets, what do you need to do to get there? And we proposed that there were 4 strategic imperatives. The first was to escape the junk food cycle. The second was to reduce diet-related inequality. We argued that while the food system couldn't solve the problem of inequality, there were interventions that you could make that I'll come on to support the diets of the poorest. The third was to make the best use of our land. How do we make sure that we're not just using it all to produce meat and actually have a more varied use of land in the right way? And the fourth was to create a long-term shift in our food culture. And I'd like to finish now by talking about that first one, escaping the junk food cycle, and the tax that we proposed as the central feature of escaping the junk food cycle. And I think it would probably be useful to talk about, to break that into talking about how we thought about the design and why we ended up with that tax. And secondly, to talk about the political issues with actually getting this kind of policy into place. So why did we go for a tax? Now, this is a chart created by Dolly Tice that shows the 14 different government strategies on obesity, on health and obesity over the last 20 years. And at the top, you can see these 3 lines are the obesity rates of men, women, and children. And as you can see, we've been publishing a lot of papers, but not making much of a dent on the problem. And the reason for this, I think, is because most of those papers, almost all of them, except for the sugary drinks levy, were built around this framing that that it was all about personal responsibility, education, and exercise. And if you were fat, it was your own. It was because you didn't get off your own fat ass and get going, and it was your fault. And that is not a particularly helpful way of framing the problem when you have this junk food cycle, when you have this feedback loop that is not working. So we looked at lots of different ways of trying to break that feedback loop, because a tax isn't the only tool in your toolbox. But we also looked at a tax. And obviously, as you will know, and he appears quite a lot in the book, although ideas about taxes for externalities had existed before 1920, they were kind of brought together and given real form by Arthur Pigou, the English economist, in his 1920 book, The Economics of Welfare. The externalities that we were dealing with then were slightly different. This is a picture of the time, of a town at the time, and smoke was one of the issues. And in fact, the first example he gives in his book is the problems that smoke causes. So he says, for this, smoke in large towns inflicts a heavy uncharged loss on the community in injury to buildings and vegetables, expenses for washing clothes and cleaning rooms, expenses for the provision of extra artificial light, and in many other ways. And he said that if you were to charge the chimney manufacturer for all of those costs, it would effectively change the situation and improve the welfare of the people living in that town. And that idea was kind of prevalent until the 60s. And in the 60s, Ronald Coase, an American economist, published a paper called The Problem of Social Cost. And he pointed out, actually rightly at the time, that there were some problems with Pigou's analysis. First of all, if you were able to define private goods properly and give people rights to those goods, that the market would actually negotiate its way out of the problems. He also pointed out that in some situations, a pure Pigovian tax, where you literally put the cost of the tax into the cost of the good, wouldn't necessarily be effective. And he pointed out that you had all sorts of other methods for encouraging modes of production: grants, subsidies, prohibitions, and obligations. And actually, if you look at, for example, the energy transition, if we had, at the beginning of the energy transition, put the cost of fuel onto literally put that into the energy system, you would have had social unrest. Through a system of subsidies, we now have solar power looking like it will be undercutting in the next 5 to 10 years very significantly the cost of fossil fuels. And I would argue that in that particular instance, that was a way of making that transition without creating civil unrest. And if you look at what Macron tried to do in France, that kind of civil unrest is very, very real. But we looked at a lot of those other things. And the problem in the food system is it is very hard to define. There are so many different categories of food. There are so many different ways of delivering food. It's actually quite hard to come up with policy in terms of grants, restrictions, obligations that can't be gamed by food companies. And therefore, we worked at length with Rachel Griffiths from the Institute of Fiscal Studies, Joseph James, who's here today, who was a civil servant in the team, who did a lot of the work, to think about how you could use a tax most effectively to intervene, but without causing social unrest. And we settled on a very large tax on the sale of sugar and salt in high volumes. So you wouldn't see it if you went to the supermarket and bought a bag of sugar or a thing of salt. But if you were a food company buying those goods in large quantities, it would cost you an extra £6 a kilo for salt and £3 a kilo for sugar. And what we calculated was that actually that would lead to a huge amount of reformulation and calorie reduction. 60 calories, was it? I can't remember. I think it's 60 calories a day, which would have been enough to more than take off the overall amount of calories that we're eating. So it sounds like not very much, but it is. But without putting up the price of food very much. But there is always the risk the price of food goes up. And while economists don't like the idea of hypothecation, giving the value of some tax to another thing, so sugary drinks levy went to school exercise, economists don't like that. It doesn't make sense. In the case of a tax where you're trying to make one end reformulate slightly more expensive, you can. And so we suggested that an amount of that money go to support for diets of those in the poorest in the form of Healthy Start vouchers, which give poor families extra fruit, vegetables, milk, free school meals, and support for children during the holidays. So that was the package. Let me end by talking about the politics. So when you look at policy, you have to do two things. First of all, you have to change the narrative. You have to change the way that people think the system works. And it's interesting, on the environment and climate change in particular, there has been huge progress, particularly in the right wing, of understanding that this isn't just a kind of socialist conspiracy intended to destroy the economy. Actually, these are real problems. In health, it is more difficult. We actually have, I'm very glad, Lord Bethell here, who was a health minister for the Tory party during the pandemic. And he saw every day he was having meetings with hospitals and just seeing how many of those ICUs were full of people with pre-existing conditions. And he's now on a mission to try and change the idea, the narrative about what it is to have a healthy nation rather than a free market nation, how the kind of essence of liberty, positive liberty, is health. Choice, negative liberty is nothing if you're not healthy enough to enjoy the benefits that brings. And in order to kind of change that narrative, you have to do it at many levels. So you have to fight. I was talking to economists who had said, well, if we didn't have a national health service, if it was private health insurance, you wouldn't need to bake in the externalities because people would pay for it themselves. And those people sit in think tanks, and you have to take them on. You also have to create a kind of better narrative than the nanny state. And I think we're getting there. And I think this is particularly actually to the more market-driven side of society. But Winston Churchill, for example, said that the greatest asset that a nation has is its health. A nation has a healthy population. And I think we can see a situation where we're looking in the UK at a population that isn't healthy, and how that not only is miserable for people involved and their families, but actually is unproductive and uncompetitive, and we need to be healthier. The second, the other element, by the way, I think goes the other way. So at my wedding, a friend of mine sang one of my favorite songs by the Divine Comedy, Songs of Love. And that has a line in it, fate doesn't turn on a wrong and right choice. Your fortune depends on the tone of your voice. And I think that from people pushing these things, the health side, they often come across as cross, angry, not understanding the political situation. And I think to those of you who engage with politicians, I would urge you to try, if you are one of those people who thinks this is so bloody obvious, why aren't they doing it, to put yourself in the shoes of the people who are policymakers and try to make it a discussion about positive things, not about negative things. And then finally, on the actual landing of policy, it is always random. So we love the idea that you get these big policy strategies and that the government will take the whole thing and put it into place. That is not what is happening ever, and it hasn't happened ever since we've had democratic politics, right back to Athens. The job of politicians is to maintain a coalition within their party, within the country, and inevitably that leads to short-termism, opportunism. So I think we as non-elected people, our job is to change the mood music, to change the narrative, and to provide ready-made policies that are there, that when Marcus Rashford campaigns for them, as he did with some of our policies, they get put into place. Or when George Osborne wants something for his budget, which he did with the sugary drinks levy, suddenly that happens. Interestingly, the budget, you don't have to write it around government. It's one of the few things that you don't have to send around government, which means it's easier to introduce bold policy in a budget than it is in almost any other way. So our job is to create the environment, the spirit, the narrative, and the policies, and then when the time is right, the politicians will take them up. It is an incredibly difficult job, but it's a job I think that this book will make a little bit easier. Thank you very much.
So thank you, Henry, for that really thought-provoking talk. We're going to pick up on many of those themes later on. But before that, we're going to have a series of lightning talks on specific aspects of health taxes covered by the book. And I'm going to kick off with Celine Colin. A very warm welcome to you, Celine, who's going to give us a taste of Chapter 2 and introduce us to the place for health taxes in the wider fiscal system. And Celine is from the OECD. So over to you, Celine.
Hello to everyone. I hope you can see the slide. So I'm working at the OECD, and we've worked on that chapter with colleagues. That chapter is really about the place for health taxes in the wider fiscal system. The three messages really that this chapter brings, and I would like to discuss with you today. Number one is there is scope to enhance the role of health taxes. Number two, the COVID crisis creates an opportunity for what we call a health-friendly tax reform at the country level. And finally, what's also extremely key is to make sure that health taxes are well embedded within the design of the broader tax system. So I'm going to go through each of the message briefly. So scope exists to enhance the role of health taxes. So the graph on the left-hand side shows that health taxes revenue account for less than 1% of GDP in all income groups. So health taxes range on average moderate amount of revenue. It represents a 2.5% of total tax revenues in high-income countries and about 4% in middle-income countries, which again remains relatively low. But let's not forget that these are averages. So that hides country disparities. And in some countries, amounts are actually significant. Let's also not forget that this is a snapshot and we don't see evolution over time here. But when we look at data, we actually observe that health taxes revenues measured as a share of GDP have increased in many countries, including developing economies. So clearly, health taxes have a significant tax revenue potential that governments should use In particular, when you think that goods that are taxed by health taxes are inelastic in demand, so can be taxed at relatively high rates. At the second graph, so on the right-hand side, here we see health taxes revenues expressed as a percentage of public health expenditures. So don't get me wrong here. It doesn't mean that health taxes revenues all finance healthcare expenditures. We are just comparing two different indicators. But so what it shows is that in some cases, health taxes account for an important share of health tax expenditures, and therefore there is potential for those revenues to finance healthcare systems. Second message is to say that the COVID crisis really creates an opportunity for health-friendly tax reform. So we know countries are in a difficult position when it comes to public finances. During the crisis, all countries were hardly hit, in particular low and middle income countries. And we know there is a clear need for more domestic resource mobilization to finance the SDGs. Countries are moving to restore their public finance as the crisis fades, and many of them have to implement tax policy measures and sometimes even tax reforms broadly. And clearly the message in this chapter that I want to emphasize is that health taxes do have a role to play in those tax reforms. They are an attractive tax instrument to increase revenue in the short run for countries, in particular, the one with low administrative capacities or the one with a narrow income tax base because of a large informal economy. And there is clearly a political momentum today that governments should not miss. Let's also not forget that we know from the past 2 years that smoking and obesity are a risk factor for COVID. So there is really a need for policy action on NCDs. So what can country do? Several options, obviously. Increase the rates, broaden the base. That means extending health taxes to products that generate negative externalities for health and that are not currently taxed, but also to improve the design of the health tax. In addition, there is also a need to ensure that health taxes are correctly implemented and enforced at the country level. Finally, last message that I want to discuss with you today is really we need to make sure that health taxes are well embedded within the design of the broader tax system. To make my point here, let me just go into an example of the interaction between the VAT, value-added tax, and health taxes, so excise tax. Optimal tax policy calls for a broad VAT base. That means that standard rates should be levied on goods and services, and countries should not use so much VAT reduced rate. And health taxes, so excise duties, are levied in addition to the VAT to play a central role in the taxation of unhealthy goods. What we observe in reality is that many countries do use reduced VAT rates for certain unhealthy goods, including food and sometimes also beverages. And in those situations, countries should really try to stop using those reduced VAT rates for unhealthy products, but tax them under the standard VAT rate. That being said, politically, it's not always easy to do that. In that case, there is a case to be made to increase even more the role of excise taxes, but this is a second best solution. First best is to use standard VAT rates. Last point, what I want to say is that tax differentiation for unhealthy products can also be implemented through higher VAT rates. That's what we observe sometimes in countries where those goods will be imposed at not the standard VAT rate, but a higher VAT rates. Again, here, we believe that the role of excise duties is the preferred tax policy choice to really tackle unhealthy consumption. I'm going to stop here. That was a short overview of chapter 2. The chapter, as you will see, covers many more issues and brings more food for thought, but I just wanted to give you today an overview of what you can expect to find in this chapter. And I'm going to stop here and leave the floor to the second author, Annalisa from the WHO. Thank you very much.
Celine, you are right. We next have Annalisa Belloni, who will talk about Chapter 4, supply side responses to health taxes. Over to you, Annalisa.
Thank you very much, and good morning, everybody. And so with this presentation, we are moving to one of the chapters that is looking at the evidence and the theory around the effects of the taxes, and is providing the information to policymakers on what are some of the factors that they need to consider when thinking about the implementation and the design of those policies. So health taxes, as most of the consumption taxes, are applied on manufacturers, and therefore for them to have an impact on consumption and ultimately health, they need to be passed on to market prices, which are the prices that the consumers face when making their consumption decisions. Our chapter 4, is looking specifically at the first step in this diagram. So what is the impact on market prices of health taxes? And we are specifically looking at the licit and purely economic responses from industries. There are, of course, other type of responses that are addressed elsewhere in the chapter. Chapter 11 is looking at international trade. Chapter 12 is looking at political responses from industries. The second step in this diagram is, of course, also equally important, which is how consumers respond to changes in prices. And this is addressed in another chapter, which is chapter 3 in the book. So what is the evidence saying about the impact of health taxes on prices? We generally see that taxes applied on tobacco, alcohol, and sugar-sweetened beverages are passed on to consumer prices. But there is a big degree of variation. And this variation depends on the type of product, the package size, or the brand characteristics. We in fact see and know that industry introduced that strategic behaviors because, of course, their aim is to maintain the profitability of their business even after the implementation of the taxes. And therefore, they can introduce some strategic behaviors, like, for example, introducing a low-price product into the market. We do have an example of this in the UK for tobacco products, for example. Another way they can do so is by differentiating the price of their products. We do have an example in the US where we see that the burden of beer taxation increases across the income distribution. And what this suggests, it suggests that the price of the products that are consumed by the high-income consumers increase more after the implementation of the tax than the prices of the products that are consumed by lower-income consumers. And this is, of course, due to the fact that there is evidence that the lower the income of consumers, the more they are sensitive to price changes. Another way manufacturers can differentiate the price of their product is by looking at the level of substitution in the market. We have the example from France in this case, where the tax on sweetened non-alcoholic beverages was fully shifted for products with limited substitutes like soda, while only the 62% of the tax was passed through to consumers for products like flavored waters, which is a type of product which is easily substituted. Another type of supply side response, which is not a price response, is a marketing strategy. And we have an example of this from Mexico, where after the introduction of the soda tax, a number of supermarkets and retailers have introduced price promotion and discounts. It is important to say that those strategic behaviors illustrated in this slide are more likely to happen when competition in the market is weak. And what I mean by this is that when we have examples of monopoly or oligopoly markets, so where a small amount of big corporations account for the larger share of the market, and therefore they have much more freedom in setting their prices. And this is important because we do have examples of this type of markets for the commodities that are usually subject to health taxes. The last type of response that has been already mentioned and is going to be the focus of the next presentation by Martin White is product reformulation. So in this case, the impact on health is not due to a change in consumption, reduction in consumption due to an increase in price, but to the availability on the market of healthier options that are introduced in the market from manufacturers who decide to reformulate the products in order to avoid the taxes. And so with this, I have illustrated the main supply side responses to health taxes and express why it is important for policymakers to know them and take them into account, because some of those responses can hinder the effectiveness of the policies, while other, like reformulation, align with it. And it is very important for policymakers to consider those responses, in particular at the design stage of the tax, because the design of the tax itself can influence those responses. So this is as well another brief overview of the chapter, and is contributed to this book that is providing a lot of support and other evidence to policymakers to the design of effective health taxes for health promotion. Thank you very much.
So following on beautifully from that, we now have Professor Martin White from Cambridge University, and he'll be focusing on the UK soft drinks industry levy as an incentive for beverage reformulation. Over to you, Martin.
Thanks very much for inviting me. Good morning, everyone. So I'm going to talk about the UK soft drinks industry levy, which appears as a case study within Chapter 4 in the book. I'm not an economist, I'm a population health scientist, and was commissioned to evaluate the soft drinks industry levy by the National Institute for Health Research in the UK. And I'd just like to acknowledge my co-authors of the chapter here and the wider team. We conceived the soft drinks industry levy as an event, an interruption within a complex system. And I won't go into details of this, but one of the things we did early on was to map out the system conceptually and think about the different ways in which the intervention might affect that system, the commercial system and the political system around it. And in doing so, we identified the different sectors that might be affected, including government, food industry, consumers, the media, and others. Using that, we were then able to identify data sources related to the different pathways through that system. And again, I won't go into the detail of this, but this allowed us to then plan an evaluation that primarily made use of existing data, which made it us able to look retrospectively and do long time series analyses. So our evaluation design had 6 work packages, and I've got 5 minutes, so I'm only going to talk about a tiny bit of this. Essentially, as I said, we theorized the intervention. We did a number of controlled interrupted time series analysis to evaluate impacts on formulation, volume, prices, purchasing, and so on. I'm just going to present a little bit of that data. We've modeled health outcomes over short, medium, and long terms. We've now got that data, and we're about to submit papers for publication. It looks very promising. And we've also conducted an economic evaluation. I'll present a little bit of that data from the micro and macroeconomic evaluation. There's also a whole package of qualitative research, which I won't go into. So just to highlight what happened to in terms of reformulation. So this chart shows over time, so it's a time series analysis from 2015 through to 2019. The announcement was in March 2016 and the SDIR was implemented in April 2018. I think this was mentioned earlier, but as you can see, this is intervention drinks, the red line here, and the pink area around it is the confidence intervals, the uncertainty intervals. But what you can see is that from the day of the announcement, there was quite considerable reformulation. So this is the proportion of drinks over the 5 grams per 100 ml threshold. For the lower levy tax threshold. And you can see that sugar was starting to be taken out of drinks, and there was a further dramatic shift in 2018. This is the control categories here, and you can see there wasn't a great deviation from our modelled counterfactual here, which is the straight line. And if we look at that in terms of sugar in drinks, pre-announcement is on the left here and post-announcement is on the right. You can see this is the distribution of drinks and the sugar in drinks. So this is sugar in drinks. You can see there's a big category with no sugar in the drinks. There's the diet drinks and so on. And then a peak at around 11 grams per 100 mils of sugar. And those are the kind of full sugar drinks like popular Coca-Cola and Pepsi and so on. Then after the levy was introduced, The levy has two thresholds, one at 8 grams per 100 mil and one at 5 grams per 100 mil. The tax burden is 24 pence per litre for drinks above 8 grams per 100 mil, charged on manufacturers and importers, and 18 pence per litre between 5 and 8. What you can see is that a lot of the sugar was taken out of drinks and appeared in drinks just below the 5 gram per 100 mil threshold, which is exactly what you'd expect to happen. So a lot of sugar was taken out of drinks and it was shifted to the lower sugar drinks. So here, sugar was replaced with non-nutritive sweeteners, artificial sweeteners, in combination with some sugar still in the drinks. But there was also an increase in drinks with no sugar in them. What we found was that there were very different behaviours of different companies, and these were just two reports in the media. For example, so the company Iron Brew, which is a peculiar orange drink from Scotland. I'm saying that for our international audience because I think people from other countries won't know what Iron Brew is. They decided to take about half the sugar out of their drink. There was a big uprising in Scotland and a lot of people stockpiled the original drink, but I think that was a temporary effect. On the other hand, Coca-Cola decided not to take any sugar out of its flagship product. Instead, what they did was to do some price flexings, and what they did was to reduce the volume of each of their offerings. So here's one example here. Their 1.75 litre bottle then moved to a 1.5 litre bottle after the implementation, and the price changed from $1.79 to $1.99. And sorry, I seem to have lost, actually, there were some figures at the bottom here that I've lost, which showed the price in pence per mil, and what you can work out pretty obviously, the price per mil goes up. So what they're doing is that they're paying for the cost of the levy, the cost to them, the manufacturer, by increasing the price per mil of their product. And we did the maths and worked out, and they actually overcosted that. So in other words, they recouped more than they spent on the levy, which is not great behaviour in my view, but you know, I'm not an economist. So lastly then, if we look at industry reactions quantitatively, we did two studies, both again used time series analysis. So the first study looked at the stock market reaction to the levy announcement. And we looked at the share value of the 4 UK-based companies that were trading on the UK Stock Exchange, London Stock Exchange, and we looked at this over a very long period. I'm just showing here that 7 days around the day of the announcement, because this was the only period in which there was any statistically significant deflection in the share price. And what you can see, there was effectively a dip in share price on the day of and the day after the announcement of the levy, and then share prices recovered. So it was a very temporary deflection. Secondly, we conducted an interrupted time series analysis. So this was using long-term data from 2010 right through to 2019. And this was looking at the UK soft drink manufacturers' domestic turnover, adjusted for consumer price index. So this is again of those 4 companies. So what you can see is that these trend lines I'm going to show on here are not actual trend lines. These are just for illustrative purposes on here. But effectively, there was a statistically significant impact on both the level and the trend of turnover in the 2-year period between the announcement and implementation. So there was a downward deflection in the domestic turnover, which then subsequently recovered. And later data shows that growth in the sector continued. So it didn't seem to adversely affect growth in the sector over a longer period. So that's all I have time for. We have a lot of other data, and you can find that online. So despite industry claims, and there was a lot of media coverage of the SDIL where industry said that it would cause massive unemployment and decimate the industry and so on, it does not appear to have been bad for industry in the early stages, with continued sector growth. Manufacturers have substantially reduced levels of sugar in their drinks, with important implications for population health. And as I say, we've modelled those, and those will be published shortly. But there are very different, it's quite a heterogeneous picture. There are very different market strategies by different companies. But I think overall the conclusion is that the SDIL did exactly what it was intended to do, which was to incentivise changes in industry behaviour. And as Henry said, that's very much the principle, the design of the sugar and salt tax that was in the National Food Strategy Plan as well. just a couple of points to broaden the public health impact. The SDIL could be extended to a wider range of foods as proposed. But in addition, one thing I wanted to mention was that the SDIL is not index linked in any way. So the 18 pence per litre and 24 pence per litre tax that was imposed in 2018 has remained the same since. And with the kind of inflation we're seeing now, of course, that tax has devalued over time. It's not such an important incentive or lever for change in the system now. And I think it's really important that these kinds of taxes should be index linked. That's all I have to say. Thanks very much.
Thank you very much, Martin. And finally, we have Sarah Mounsey from Imperial College, who will talk about Chapter 5, the labour market impact of health taxes. Over to you, Sarah.
Thanks very much. Thank you. Thank you for laying the groundwork for me. It's a great way to start. So we've been brought together to do this book chapter because although health taxes, as you've seen already today, are quite effective for improving health and reducing consumption of unhealthy products, there are some hesitation from policymakers due to claims, often from industry, about the negative impacts on labour. So we brought together the evidence around the world to examine the validity of these claims. So the chapter centres around a conceptual framework, and it's a lot less complicated than Martin's, and this is available in the book. And this framework actually guides you through and underpins the mechanisms of interactions between the health taxes and the labour market characteristics. And it also frames the evidence, which is both from empirical studies and modelled studies for tobacco, alcohol, and diet-related taxes in turn for two key outcomes, and that is employment and productivity. And I'll just spend a couple of minutes now going through each of those. So for employment, the chapter concludes that taxed industries are likely to see some employment reductions, and that we've seen already today by Annalisa depends a lot on various circumstances, which we highlight in the chapter. But the important thing is to note that it's probably short-term in effect, because what happens is when consumers stop spending on the taxed goods, they tend to spend on other goods and services, and thereby creating increased employment requirements in those sectors. And we call that a sector shift. Taxes will be generated, and we've already seen that again today. So this revenue can contribute to this sector shift effect, but it can also be recommended to be invested to retrain employment that have been left, individuals that have lost out or been displaced from their employment. And an example is tobacco or sugar farmers, and they can be retrained to either grow different kinds of crops or enter into different livelihoods. We highlight that the evidence has been generated largely from industry-funded reports, and these reports use methodology that are limited in providing or incorporating this sector shift. So therefore, they give partial results. And in actual fact, more robust studies have shown that there's either far more moderate reductions or even negligible reductions. And in some studies, we've seen employment gains. And that's an important concept to keep in mind. The next one is productivity impacts. So we start the chapter by assessing the losses and costs associated with consumption of unhealthful products. And we use a lens of ill health to consider presenteeism, absenteeism, premature retirement, and premature mortality. And we use that as backdrop to then illustrate some of the evidence from around the world on the gains that can be achieved through the use of health taxes. And for that, Australia provides some really compelling evidence for significant productivity improvements as well as cost effectiveness with design targeted health taxes. That's it. I'm going to wrap up now. But the take-home messages really is that the use of fiscal policy is an effective WHO Best Buy tool, and any concerns of claims of employment loss and economic downturn tend to be overstated. And I think the main thing is it's crucial for policymakers to considering the implementation or scale up of taxes to really critically assess the evidence, who's funded it, and when they're making decisions. That's it, wrap up. Thank you.
Thank you very much, Sarah. So we now have the editors here, our editors online, Jeremy and Agnes, and we're now going to go into a panel discussion about some of the themes we've heard. So the obvious question to ask is, the book, as everyone says, is extremely timely, which it is, given we are in the post-pandemic, well, maybe not quite post-pandemic, but we are trying all to recover from the pandemic, which makes it crucial given the role of health actually in COVID outcomes across nations, that something is done to improve global health. But it also doesn't it make the same fact that we are recovering from a pandemic make it very hard to make health taxes a viable political proposition? So I just want to kick off with that as a broad question. Who would like to take that?
Okay, talk the political side of it. So I think that there was a moment. I mean, I'm talking particularly about the context in this country, but there was definitely a moment through the middle and towards the end of the most serious part, the most serious in terms of health terms part of the COVID pandemic, where there was real alignment on the fact that we needed to create a healthier population and that we needed to be bolder than we had been, and that we needed to I was understood that the state needed to intervene more. We'd seen the level of intervention that the state was prepared to go to prevent this, to cure. So it was understood that it could have been a lot cheaper to prevent. I think that actually it isn't the COVID pandemic that has got in the way of that. It is the Ukrainian war. So it is the Ukrainian war, and I guess the inflation, which is partially caused by the COVID pandemic, or the response to the COVID pandemic. So it is very, very difficult politically to, even if it is a reformulation tax, to introduce a tax on food or increase taxes on cigarettes or alcohol or whatever. And in this country, we also have that combined. So it takes a lot of political capital to do that. It takes confident politicians on the front foot, and in this country you also have that combined with Partygate and the kind of the loss of political capital. You know, we've gone for a government that had in all the polls huge, unprecedented midterm leads, that now has a 30% swing this morning in a by-election against it, and I think that makes it very, very difficult to foresee in the near future the combination of those two things, anything kind of significant happening in this country. Having said that, our health secretary in 3 weeks' time is proposing his health disparities white paper. So in this country, people in the poorest 10% of locations live 7 years less long than those in the richest, and actually they are living less long than they did 20 years ago. And it is recognised that that requires intervention. He's doing that, and he's got Chris Whitty, who led us through the pandemic. So it'll be very, very interesting to see what comes out in that white paper, because I don't think he will be able to get away with the rhetoric of individual responsibility, because it just isn't true, and he knows that. And so if it's not a health tax, what is it?
So to be clear, do you think health taxes will feature?
I would be I don't know, I'd be very surprised. I think even if you had a prime minister at the height of his powers with a massive lead, just the political difficulty of introducing anything that seems that could be perceived, even it isn't, to add to the cost of living is very, very difficult. So I think actually, even if you had but we'll see.
So going on from that, obviously the thing that's picked up, the issue that's picked up in the book, and I think actually is discussed very well and very sort of in a very balanced way, is that often health taxes are regressive. So they do impact lower income households more. Franco, could you tell us a little bit about how you bat off or bat away those that point, that criticism?
Well, I think we have to distinguish different taxes here, because not all health taxes are regressive, and I mean alcohol taxes are not, for instance. Sugar sweetened beverage taxes are, yes, they are regressive, but if you look at the extra burden that they involve for people of low income, that we're talking really about a tiny amount of money, a few pounds per year for a low income household compared to a high income household. So that's not really a kind of regressive effect that we should be concerned about. I mean, tobacco has bigger regressive effects, but the benefits, the health benefits that tobacco taxes bring to people translate into economic benefits because, as Sarah's shown, the productivity gains that we can get from the use of health taxes are so large, particularly for tobacco taxes, that in the end people are going to gain more than they lose by paying more taxes.
So I want to bring in Jeremy and Agnes here. As well, because obviously this is you discussing the book, and everyone here, I think, is clear that health taxes are a positive move in terms of human flourishing, as Jeremy sort of very poetically put it. How do you move forward with a book like this, implementing it, turning it into something that is used across the world? Who would like to come in on this?
I think it is a change of paradigm, and health taxes have been around for a long time, as we know. If we look at tobacco and alcohol, this has been a very long journey. So we've learned a lot, and what this book says, it really works, and it can really fundamentally change the way we look at some entrenched public health problems. And the discussion today and the talk we just heard places this issue at the center, in the sense that it's not just one more instrument or one more tax. It's really, as I mentioned earlier, it's a change in the way we see taxation as shaping markets and behaviors. So yes, it is regressive if it is seen in isolation. But if it is seen as an overall different way of conducting fiscal policies, and in which there is a full attention to the issue of affordability and price and regressivity, and that it may actually be that more nutritious food, more desirable market behaviors be promoted. So it's really about that behavioral change and shaping of markets, which we haven't fully grasped. And this is why the whole health taxation conversation needs to move together with the investing in the commons discussion about how to tackle the formidable challenges that are ahead of us in terms of our food system, in terms of the environmental impacts on health that are coming our way. And the conversation needs to be at the heart of the public health conversation. It should not be just a small agenda. We together in the WHO, we published this guidance note on investing in commons for health as it was just published just before the COVID pandemic, but it was as if we had predicted it. It's really those 5 core public good functions, and taxation and subsidies is one of them. And really that thinking that taxation is not only about raising revenue, but that it is an incredibly powerful instrument to shape markets in behaviors, need to be much more centered in the public health conversation and in the societal post-COVID conversation. And I think that's of course a challenge, not that things are easy, but that there's really this question about, which is very similar to the taxation of fossil fuels, right? So the environmental question and the health question needs to be joined. And I think it would be a mistake to keep the health taxes discussion within the sub-discussion of NCDs, because health taxation is also a tool that can be used for communicable disease. If we think about the question of husbandry and whether this is poultry or beef production. And that's really that thing, this book sets the scene for that, for a broader conversation. And having this discussion about taxes recently, I was in many meetings on One Health, and surprisingly, this topic was never touched upon. And I was really happy to have the opportunity to say, as part of the One Health conversation, we need to have a whole line that looks at the question of fiscal instruments, because these are really incredibly powerful.
Thanks. Jeremy, did you want to come in here? Because with your background, you can give us a kind of broad idea of how things really need to change fundamentally in order to accommodate health taxes.
Well, thanks. And I really want to echo and amplify what Agnes has been saying. But I'd like to take I'd like to look at that through the lens of a particular example. For a long time, we've been talking about how there's no money to do things. We have to cut services. We have to cut public expenditure, everything. There was one moment really of global optimism around 2002 when, nation states around the world got together and said, we have the money, we have the will, and we have the way. And they created the Global Fund, and they put over 20 years about $50 billion into it, which is tiny. It's nothing at all. Now, we've just gone through 2 years and more of a COVID epidemic. And in those 2 years, those same governments have put $20 trillion and counting of public expenditure into what is essentially a health issue. I mean, a lot of this money is fiscal stimulus and support for furlough and so on and so forth. Now, one may say, we have inflation, that's bad, but really, what's the counterfactual? A global economic winter that, the only other thing that could have created such a catastrophe would be nuclear war. So, there is something called the public sector. As much as certain representatives of government would like us to believe that there's only the individual, there is collective action, as Agnes has been saying. There's the possibility for coherent and strong collective action around a program of policy to which everyone assents.
Thanks, Jeremy. Angela, can I bring you in? Because you work with all the agencies and these multilateral organisations that have great influence, the OECD, the World Bank, and so on. What is the appetite, do you think, and what is their take on how fiscal redesign has to happen? Are they at one with that philosophy, with the philosophy here?
Yeah, so I think there is a positive reaction, positive opinion among the development agencies that we work with. They do think, for instance, our counterparts at the World Bank think there's really a place for health taxes for rebuilding, maybe not the post-pandemic yet, but within the context of COVID-19. And I just want to go back to your earlier question about political appetite from the countries. Is it reasonable to propose health taxes at this time? We've had recent conversations with legislators. So these are decision makers who haven't been as steeped in health taxes as we have probably, and you'd be surprised that they are interested. I think health taxes are underutilized globally, so they haven't raised health taxes in a while. A recent WHO report found that only 13% of the world's population, or in around 40 countries or so, are covered by tobacco tax rates, which follow the WHO recommendation. So that's a very small population. So there is scope to raise them. Granted, I think maybe they're interested in the revenue impact of health taxes, but when they hear about the health impact, and they haven't heard these points maybe as often as we have, it's refreshing to them. It's really, it hooks the bit. So there is appetite, I think, and the challenge for us advocates is to, as Henry mentioned, change the narrative. One book is certainly not going to change the narrative, but I think the challenge for us health taxes advocates is to take what's in the book and reframe them and make them relatable and digestible to decision makers. So, yeah.
Thanks. And Henry, I want to bring you in because one of the things I think is quite striking is the public narrative on health taxes. And in the book, I should say, it's not just about sugar, salt, processed foods, etc. And alcohol. It's also, you widen the scope quite considerably. So, for example, taxing the consumption of fossil fuels, which would not only kind of improve health, but also, I suppose indirectly as well, but directly have an impact on the climate issue. Where is the public voice? And Henry, you may be good here because you do a lot of the outreach. So because we've heard a lot from multilateral agencies, we've heard from policymakers, or we hear from politicians. What does the ordinary person think about health taxes generally and extending them?
So I can talk about UK citizens. As part of the work we did, we travelled around the UK, to all parts of the UK, kind of informally, visiting everything from farms to food banks. We also conducted a series of citizens' dialogues, again in all different parts of the country, where we brought together a group in each one of 100 citizens, demographically selected to represent their areas, and we brought them together 3 times. So there was kind of education piece, discussion piece, and then decision piece. And the answer is it depends on what the issue is. So, for example, on the sugar and salt reformulation tax, people of all demographics are so fed up with the level of marketing of junk to their children, to them. They're fed up with the food environment. And we had actually, as well as this, when we got the policies, we had one of the leading kind of pollsters discussion who work sometimes for the Conservative Party here, run the policies past. We thought, and he thought, that the sugar and salt tax was definitely electorally doable. If you look then, you talked about fossil fuels. If you look at meat and the carbon impact of meat, not just from the methane, but actually more from the land that it takes up. When we talked about a meat tax in a UK context, you could feel the crackle of energy in the room, and there is something, it was really visceral. There's obviously clearly something deeply culturally embedded in the UK culture about meat, and not wanting the government to get involved. And we said, actually, on meat, we think that if you put a tax on meat, not only would it be deeply regressive, because it would be, if you did it per gram of carbon, it would be much more expensive on mince than it would be on a fillet steak. But we thought it was politically undoable. So with meat, we said, actually, what you need to do is change government procurement, invest in methane reduction technologies, and invest in alternative proteins. And we think you can get the meat transition to happen without actually having to do the tax that we thought any government who did a meat tax would be out on their ear within months.
Would be mince.
Would be mince, yeah.
And could you, for example, have a tax on red meat, but not healthy?
Well, it's interesting. Meat. So when you get the reason that we chose sugar and salt as a per kilo for the tax is, whenever you get into definitions, it becomes very, very complicated, and there are all sorts of ways to game it. So that is why, for example, even taxed on HFSS food, rather than the salt and sugar, is just a nightmare. So you say, is it on cheese? It's in certain categories. It's only on processed food. Is this processed? Very quickly it becomes horrifically complicated. So the one thing I would say with these taxes is, the simpler the object of the tax, the better. If you think you can get around it with, we had a wonderful man, Tim Lernig, who's now our Chancellor's Chief Economic Advisor and a professor at LSE, and we kind of gameplay with Joe and various others. Okay, if we were, trying to get around this, how would we do it? Almost every single version that isn't a pure tax on something very simple, you can work out how you get around it in about 5 minutes.
Brilliant. And because it's, before we move on to our Q&A section, can I, as a sort of moderator's prerogative and as a journalist, ask a really stupid question, which is, if these things are so bad for us, why can't you ban them? I mean, is that just too extreme? Because we are, in some sense, we are saying that you shouldn't be eating this. You know, we are, you shouldn't be doing this. Actually, why? I think it's very interesting what New Zealand have done, where they're actually changing the rules around the purchase of tobacco, so that as children grow up and become adults, they will no longer legally, even at the age of 18, be able to buy cigarettes. I mean, is that what are the obvious arguments against that?
I think tobacco is pretty unique in that it is the only product sold to us that will kill us if we continue to do it. You know, are you going to ban ice cream? Are you going to ban sweets? Are you going to, like,
if I can?
Yes, Jeremy.
I mean, I think, you know, the question that you ask is really, you know, what is the appropriate policy response for, you know, this range of activity that seems to be, you know, health harming, right? And, you know, when I was saying that health taxes are empowering of individuals, what I mean is really focusing on the information content that they contain. There's a double hit to the health taxes. It hits you in the wallet, yes, but it also hits you in your cognitive understanding of the impact of that product on your health. And ultimately, a centralized measure such as taxation that is, you know, a push or a nudge or whatever we want to call it, is not as powerful as something that, you know, maybe comes integrally from the context at the decentralized level, where individuals are actually forming their own opinions and bringing the knowledge that they have and the resources and the skills. But as a bridging measure, they're not bad. I think, you know, the regulatory approach of banning things is just short-circuiting that whole cognitive pathway, that ultimately people are stewards of their own health. And we want them to be better, more enabled, more empowered stewards of their health.
Thank you, Jeremy. I think that's a really good point at which we can move to the Q&A. So I would like to invite both people in the room, people online. We have Jack, who's going to be funneling questions online to us. Please, if you have questions for our esteemed panel, lovely. So we'll take this gentleman here and then we'll take this lady here. So we'll take your questions first, your two, and then we'll put them to the panel.
I'm James Bethel. I was Minister for Health during the pandemic. And can I just start, since I'm first up, to say thank you very much for this. It's a really powerful piece of work. I agree with Jeremy that we do need to be positive. We need to have a sense of collective action, and we need to believe in policy and that policy does work. And there's a lot of scepticism, not least in the Treasury, but also amongst the public, that interventions work at all. They do work, and this is a good piece for doing that. If I can just ask two questions about it. Firstly, the phrase health tax for me, although it's sort of, you know, has the advantage of doing what it says on the tin, actually fills me with horror, because when I was a health minister, I was very conscious that the Department for Health was being scapegoated for the country's health, whereas most of it, 2/3 of it, had nothing to do with us. It had to do with clean air and people's activity and their mental health, which often had nothing to do with us. We could probably account for about 1/3 of it. So having health taxes does not account for all of the other parts of people's lives. It also implies that the costs of bad living, bad decisions, are felt only in the health budget, whereas actually it is the productivity of the country and the costs to welfare and pension, which are where the really big sums of money are involved. And so I'd just like to suggest and ask the panel, is there a way of linking this much more directly to a broader agenda about trying to make the workforce of, say, this country much more productive, longer lasting in the workplace, not more years of healthy, happy, hard work, and fewer years of being poorly, in hospital, in rehabilitation, being paid social care? Because that politically, and that's really what my contribution is, that's the argument that I can win. I can't win an argument that says, if you stick a tax on burgers, we're going to shave some money off the healthcare budget. I can win an argument that says that we're going to be a highly productive country.
So sorry, I'm just conscious that we don't have much time, and that so is your essentially you're saying that you would like health taxes to be renamed?
Much beyond that. I think there's a scope.
And do you have a specific question for a specific member? And
No,
then we can move on.
No, I'm giving my reflections.
Okay, so that's a comment. Okay.
I've got another one.
Brief, please.
Secondly, innovation. I think you're right that this is a lot about trying to change behaviours in the business. We need to champion the fact that there are good alternatives. We need to champion unleaded fuel. I remember when unleaded fuel came in, it's cheaper than leaded fuel. A lot of people were sceptical about putting it in their cars or buying an unleaded car. We need to make sure that people understand that there are alternatives to the fillet steak and to the burger that are delicious, that the fizzy drink that had the brew drink that had the taken out was as good, and that the San Pellegrino drinks that have all the sugar in don't sell very much at all. If we don't champion innovation, then we're just taking donuts away from poor people.
I would love to that first question about the framing. I would love to hear Jeremy or Agnes's view on that, because for me, fundamentally, who, which is the big frames this whole debate, is really critical. So I saw Jeremy nodding along to what was being said. I'd love to hear what he feels about that framing element of it.
Well, I mean, I'll try to be really brief here. I fully agree. Sadly, we failed if we didn't get there with health taxes. And we didn't invent the term. We picked it up in a discourse that was happening. And we, said, this is good. And we heard from a number of people who were saying environmental taxation, health taxation. These are concepts that people can make a bridge between. So the term is, it's expressive, it's specific, but absolutely correct that what we really want to be linking to is the whole agenda of human flourishing. All of these lives, stunted and foreshortened needlessly, or capacities for longer, more satisfying, healthy lives, with families and friends and satisfying careers, not just higher wages. How can we, really make a bridge to all of that? I think that when we think about fundamental constituents of welfare, health, education, physical integrity, agency, are among the chief ones. So I think we're not far off, but if we haven't bridged enough to these other domains, then we have to think about that, how to do that in the communication, because it's essential to do it over.
On that point, I can imagine how kind of headlines would work with health taxes, and they're not going to be kind, I suspect. And sorry, we didn't get your question. Did you want to ask a question?
Yes, please.
And so please do say who you are, where you're from.
I will.
Thank you, and keep it brief. Thank you.
Hello, I'm Kelly Parsons. I am a researcher at the University of Cambridge. So my question is, given that health taxes represent a coming together of fiscal policy, health policy, potentially departments, political interests responsible for the feed industry, you talked about sort of brokering between different parties. What have we learned to date? And I'm thinking particularly about Henry's work on the salt and sugar tax, but also the soft drinks industry levy, about developing, incentivising, embedding those sorts of links between those different policy areas and interests.
So I'm not sure whether our online audience heard, but the question is given that health taxes really cross a lot of departments, how do you get that embedded? How do you get that sort of interlinking to happen in a functional way that delivers what you want? So who would like to take that?
Well,
maybe a double act, Franco and Henry.
Go ahead first. Yeah. So it's even harder than I thought it was at the beginning, and I think there are three things that will happen. One is you have to get a narrative that, as we were just discussing, that all departments can get behind. There has to be something in it for them. The second is it actually depends enormously on specific personalities and personal friendships. So when these things go round to write around, they have this where they send it round the different departments, and they have a kind of passive-aggressive thing where they change the text, and then the other department will change it back, and then they'll change it back, and they'll change it back. And then if they can't agree, it goes to number 10, and number 10 decides, our Prime Minister decides. And actually, when you get things through, it's because those ministers are texting each other and they've got a good relationship. And that is almost by accident. And therefore, the third thing I think you need, which actually the thing that I was saddest that the response to my work didn't have on Monday was you need to have on statutory footing. So if you look at what we did on climate change in this country, by embedding a statutory, legal target, and then creating a body in the Committee for Climate Change that reports back, marks the government's homework on that department, you make sure that even if you have a moment where you don't have that chemistry going on, there's always something there to bring it back to this government, future governments, and keep the momentum going.
Okay. I just want to say that government politics, between different government departments is very complicated, but there are clearly natural allies of health ministries, namely the environment department is usually a very, strong and close ally of health ministries. Of course, there are also government departments that are very opposed to the idea of having health taxes, but the real gatekeeper is Treasury, of course. The gatekeeper that decides when taxes are introduced or not is Treasury. What we argue in the book, in the final chapter in particular, is that health ministers have a very important advocacy role in advocating for health taxes. But they shouldn't be accepting any tax as a health tax because for a tax to be called a health tax, it needs to be, to have very specific characteristics and needs to be in a position to improve health as well as, human well-being. So I think they should really be very strict on, what taxes can be named as health taxes.
Lovely, thank you. Jack, do you have some online questions? Would you like to say a couple?
Yes, of course. Okay, great. So I've got a question here from Norman Maldonado.
Might be speaking to your mic.
Online, hopefully you can hear me. So he's asking, what is the book's perspective on taxing already reformulated products?
So those are products that have already been reformulated and then taxing.
Correct. So sort of calorie-free beverages, zero sugar Coke.
Franco, I think you should take that one.
Yeah. Well, calorie-free drinks are a very complex area. I mean, there are several people from the WHO here, and WHO. We have been waiting for years for the WHO to say a word about whether we should be switching from sugar-sweetened beverages to our calorie-free beverages. Hopefully that guidance is coming soon and we'll know what to do with that. The kind of reformulation that Annalise and Martin in particular have been talking about is a reformulation that is taking place to some extent. Ideally we would want more and Henry has proposed a framework for incentivizing more. Clearly, to the extent that reformulation is incomplete, products will continue to be liable to taxes, health taxes. But the idea is that taxes will continue to incentivize reformulation, including for the products that have already been reformulated to some extent. And we do see in analysis like the ones that Martin has been doing, that reformulation takes place in multiple steps. It's not just a one-off. It does reformulate gradually. I don't know if Martin has any.
Jack, do we have another online question?
Okay, so this question we have from Abdiraham Ibrahim, who's asking, he's saying that excise taxes were meant for alleviating the health harms caused by certain products, and their application on reducing the problems should be essential. His question is, what can be the consequences when governments divert those taxes to use in other forms?
So do you mean, does the questioner mean that sort of if you're diverting the revenue?
Correct, yes.
From health taxes into non-health spending?
That's exactly right.
Perhaps, Anjali, would you like to take this one? I mean, is that common actually with health taxes now? I don't know where the revenue goes. I assume that they go to full health spending.
So the question of earmarking or hypothecation, it's an issue that often comes up in health taxes discussion. So we thought it would be good to have a discussion on this in the book, and you'll see the chapter prepared by our health financing specialist, Susan Sparks, and tax expert from the World Bank, Sharon Ozark, in the book. They discuss these issues. So I think there are several countries which earmark health taxes for health purposes. So in I think a 2017 report, of the 80 countries that were surveyed, around 54 earmarked for health. But it's not, WHO, this is make a sort of a clear recommendation on this. So countries are free to use health tax revenue in any way which is appropriate to them. So it's a little bit difficult to answer what would happen if it's diverted for a purpose that's not specified. Yeah, it's I turn over to Jeremy.
Well, if I may, maybe here, I think that very clearly the book doesn't define health taxes as the revenue going to health. It defines health taxes as fiscal instruments that influence behaviors and markets so that it leads to better health and healthier behaviors. In fact, I would suggest that we don't use the word diverted. It doesn't matter. In fact, what is important is that the taxes shapes the market, but the revenue, sometimes it is useful to earmark it, mostly actually for political economy reasons. That it's actually a very good argument to make. People are more likely to accept the taxes if they actually go for health. But in France, for example, some of the taxes go to pension schemes. And it was also part of the political economy when it goes to the pension schemes of farmers. But in terms of revenue, we know that revenue are fungible, and that the potential additional revenue that these taxes would bring can be, even if they are earmarked, usually what happens in the midterm to long term, they can be a rebalancing with less general revenue going to specifically the health sector. So generally, I think the book goes on the side of earmarking is really not the central question, and it may have short-term benefits, but in the long run, it's not terribly important.
So just Agnes is absolutely right. So the economic theory is that hypothecation is meaningless, effectively, except where you're trying to, so in our case, where you're trying to make the bad stuff more expensive and the good stuff cheaper, where it is, the economists will tell you you're allowed to do that. But I think that, as you said, it is hard to underestimate how much citizens don't understand that particular point of view. And for example, with our sugary drinks levy, it all went to exercise in schools. So politically, it's dynamite, hypothecation, and link it to other things. So I think, as you said, it's a political thing, but it shouldn't be written off just because economically it's nonsense.
That's great. We had one question at the back. It's the lady on the end, and then we'll wrap up. Thank you. Who are you? And
thank you very much. Yes, my name is Elisa Pineda. I'm a researcher here at CHEPI. I'm a public health researcher and also a food researcher. So I'm very interested in learning the political perspective that was mentioned by Henry and also Lord Bethel. So what would be the required type of research, and how to make sure that that research is really efficient to translate into the argument that was being discussed, to really make those health taxes being effective, but also not just focusing on the health taxes, but also improving the food environment that allows consumers to have healthier dietary patterns. So I'm interested in learning a bit more about what can I do as a researcher to improve that argument.
That's a great question. So I'm going to go to you, Henry, to finish up, because really, what's the killer piece of research that you need to present to someone like Lord Bethel that can persuade him and his colleagues to market these and get them?
Yeah, so it's interesting. Well, I think the question was like, if framing is so important, what research can you do to show that framing works? Is that right? And I think that, there are, I'd be very interested in James's answer to this. There are some, there's the Framework Institute, there are some people doing some work on this, but behind the scenes, political parties spend a lot of time with their internal advisors listening on framing. So we try to use citizens' dialogue, citizens' assemblies, but genuinely trying to understand the citizenry. You said earlier on, about the concerns over how do we bat off that concern, and that is exactly what politicians are expecting people in this room to do, not think seriously about what the voter thinks, but try and bat off people. And I think actually if you could do bits of research that really convince them that they can not only make the country a better place, but do so in a way that makes them electable by doing that framing research, whatever form that takes. That would be incredibly valuable.
I think
that's a great point.
I think that's a great point on which to end, so that we can go off and have some food and drink of our own. But so sadly, all good things must come to an end, and today is no exception. I hope you've enjoyed it. I would like to thank everybody who's contributed, our editors, our panelists, our audience in the room, our audience online. Thank you very much. I want to congratulate the authors on a really important book. I really do feel like this is a moment in kind of fiscal landscape, and we are all beginning to think about how we're going to recover from the pandemic. I want to say, as well as the thank you to the people down here and in the room, I want to thank Jack Olney and Lorraine Sheehy, who have done an incredible amount of work to put this together. I want to encourage you to carry on thinking about these important issues, whatever you're going to do now, wherever you are in the world. And for those here at Imperial, I hope you'll carry on the conversation in the foyer with coffee. So please join me in thanking everyone involved.